Hello, my name is Michael Uwe, and today I am going to talk about what is the main focus of palliative care. Before I discuss the main focus of palliative care, you first have to learn what palliative care is. Palliative care, also known as comfort care, is a medical specialty that does not only focus on the dying, but also focuses on improving the quality of life for the people of all ages that suffer from chronic, serious, and life-threatening illnesses. The main goal of palliative care is to help individuals with serious illnesses feel better, as well as to improve the quality of life for the family. It is meant to help treat or prevent symptoms that may arise due to the treatment that the patient may be receiving, and or help with side effects from the disease that is present. Palliative care also helps to treat those that have problems emotionally, socially, and spiritually. These problems may come as an effect of the illness, and treating these problems can overall improve the individual's quality of life. Palliative care can also be provided at the same time that treatment is provided to help cure the disease, and can also be given when the disease is diagnosed. It can be received throughout treatment and at the end of their life. Palliative care also affirms life and regards that death is a normal process of life. Palliative care can also be used in a combination with other treatments such as chemotherapy or radiation. When should one receive palliative care, and who provides it? A patient does not have to wait until their disease is at a serious stage, or if they are at the end of their lifetime. In fact, the earlier that an individual receives palliative care, the better. Patients may move into palliative care when it is needed, and the patient may move out of palliative care when it is no longer needed. When worst comes to worst, palliative care can even turn into hospice care. There is no limitations for how long one can receive palliative care. Some may receive palliative care for years, while some may only receive it for a few days or weeks. Palliative care can be offered by hospitals, home care agencies, cancer centers, and long-term care facilities. Palliative care can be provided by a team of doctors, nurses, and nurse practitioners, physician assistants, social workers, and even chaplains. Types of doctors that may be a part of the team include physicians, surgeons such as oncologists, neurologists, and psychiatrists. The role of the nurses is to manage ongoing care and treatment that is received. Nurses assess pain, manage symptoms, and plan and administer daily treatment. The role of the dietitian is to provide psychological support to the patient as well as the family. They provide nutritional counseling and explain the social significance of eating meals as a family. The role of the social worker is to conduct psychosocial assessments as well as coordinating care providing counseling. They educate the patient and the patient's family about their treatment and their available resources. Chaplains are there to provide spiritual support as well as to help the patient and the family explore deeper into their faith and move towards acceptance. What does palliative care entail? A serious illness does not only affect the patient's body, but it can also affect the patient's family and his or her life as a whole. Some symptoms that come with physical problems include pain, trouble sleeping, shortness of breath, and loss of appetite. Treatments for these symptoms or side effects include administering medication, giving them nutritional guidance, physical therapy, occupational therapy, and integrative therapy. Palliative care can help care for patients who have emotional or social problems. During this time, the patient and the family can face stress due to the illness, which can also lead to depression, anxiety, fear, and or hopelessness. Treatment for this type of problem include counseling, contacting support groups, having family meetings, and providing referrals to health providers. Another problem that a patient might face could be a practical problem. These include having problems with money or with their job. It also pertains to insurance questions as well as legal issues. To help a patient going through this problem, it may include helping families understand the treatment choices that they have at hand, educating the patient and the family on complex medical terms, or to refer the family to financial counseling and or help connect the family and patient to resources for transporting or housing. Putting aside worldly problems, the patient may also have trouble with spiritual issues. This means that the patient may question their faith or look for meaning in it. The palliative care team may contact a chaplain or help the patient and family explore their belief to help move towards peace and acceptance. In the end, palliative care is a holistic focus. It does not only focus on the disease or illness at hand, but also the well-being of the patient and the family of the patient. Before I talk about how hospice and palliative care are different, I would like to first briefly discuss what hospice care is. Unlike palliative care, hospice care is more focused on the end of the patient's life, while palliative care can be provided as soon as the problem is diagnosed. People generally turn to hospice when they have 6 months or less to live, in accordance with their provider. When the patient is rapidly declining. Before I talk about how hospice and palliative care are different, I would like to first briefly discuss what hospice care is. Unlike palliative care, hospice care is more focused on the end of a patient's life, while palliative care can be provided as soon as a problem is diagnosed. People generally turn to hospice when they have 6 months or less to live, in accordance with their provider. When the patient is rapidly declining, even though they are receiving medical treatment such as losing weight, the inability to perform daily activities, or decline of their mental status. Hospice is also turned to when the patient is ready to live more comfortably and to aim at prolonging their lifetime. Hospice care, also known as end-of-life care, focuses on helping people who are dying to live comfortably and to have peace and to have dignity. Hospice can take place at home, at a facility, at a hospice center, or even in a hospital. Some treatments provided during hospice include medication for pain, such as morphine, and other strong medications depending on their level of pain. Short-term inpatient care. This means that the patient goes to a facility or hospital when their pain or symptom management cannot be achieved at home. Short-term respite care. This means that it is temporary relief from caregiving as to not address and avoid caregiver burnout, and may even include grief and loss counseling for the family to help them cope with the loss of a loved one. While some may think that palliative care and hospice care are the same, they are indeed different. Hospice mainly focuses on the last 6 months of someone's lifetime. When it is determined that cure is no longer an option for the patient, that is when the hospice care team comes in. The goal is to make the remaining life of the patient as comfortable as possible. Hospice treatment also begins after the treatment for the illness has ended. The hospice care team addresses physical symptoms and spiritual and emotional issues as well. In regards to hospice, people hold the belief that when someone receives hospice care, their death was imminent and immediate. While palliative care aims to manage pain and symptoms, can also be delivered with other aggressive treatments for the illness. It can be provided at any stage of life. Palliative care undertakes the philosophy of full patient care and can be performed for non-terminal patients as well. Unlike palliative care, hospice is able to provide not only medications for the patient, but also medical equipment such as wheelchairs, canes, IV bags, etc. For palliative care, they only provide comfort care, such as providing emotional support and spiritual support, administering medication to help with nausea and pain. In palliative care, injections and lab work is also stopped. Some common questions that one may have when receiving palliative care are, What is palliative medicine, or how are palliative doctors different from regular doctors? In this slide, I am going to answer some of the common questions asked by individuals who are receiving palliative care. To start off, what is palliative medicine? Well, palliative medicine is medical subspecialty provided by doctors who offer palliative care for people who are seriously ill. Palliative care relieves suffering and improves quality of life for people of any age and at any stage in a serious illness, whether that illness is curable, chronic, or life-threatening. The answer for the differences between palliative doctors and regular doctors is that a palliative doctor is whole person care that aims to relieve symptoms of an illness, disease, or disorder, whether or not these conditions can be cured. A specific type of palliative doctor would be hospice. Hospice is for patients who have 6 months or less to live. Hospice is always palliative care. However, palliative care is not always hospice. Some people may think that once they take up palliative care, they think that they have given up. However, that is not the case. Palliative care is meant to make the patient as comfortable as possible and to help achieve the best quality of life. Palliative care can be provided with any ongoing treatments and may even reverse or cure any effects that an illness might have. Palliative care can also help us keep symptoms under control and may even help with aggressions of the treatments received. Other patients think that all doctors should be concerned with alleviating pain and their quality of life. However, palliative doctors have special training to help manage symptoms and pain. They not only help the patient cope with any problems, but the patient's family as well. Palliative doctors help the patient and the family make medical decisions that may deem difficult, and help educate the patient on the pros and cons of each treatment. The last answer to the question is, will I still be able to see my doctor if I receive palliative care? Well, the answer is yes. The patient will be able to see their personal doctor because a palliative doctor coordinates with the personal doctor of the patient. It is common to think whether or not palliative care really is as effective as it sounds. The answer to that thought is yes. Palliative care is indeed effective in many ways. Palliative care is the approach that aims to improve the quality of life for all. It prevents and relieves suffering through assessment, early identification, and pain treatment. To make palliative care effective, a care team is used to support the patient as well as the caregivers. This includes addressing practical needs and also offers a support system that aims to help patients live as actively as they can until their death. Palliative care decreases the need for unnecessary hospital admissions because patients have the options of being cared for in the comfort of their own home. Palliative care does not only focus on the physical being of the patient, but also the emotional and spiritual states of the patient. Counseling or chaplain services may be offered to the patient. Palliative care may be required for a wide range of diseases such as cardiovascular disease, cancer, chronic respiratory diseases, AIDS, and even diabetes. The need for palliative care is not always needed for the dying patient. Some other conditions that may also require palliative care include Parkinson's disease, kidney failure, chronic liver disease, etc. To help with the most common symptom, which is pain, opioid analgesics may be administered. Opioids help alleviate common physical symptoms such as breathlessness. Palliative care is effective in relieving by addressing the symptom in an early stage. Palliative care focuses on the person as a whole and not only on their physical or medical problem. The last thing that palliative care focuses on is on how to maintain patient dignity at the end of life. One of many fears one may have in regards to death is her loss of dignity and independence. Fortunately, palliative care is built to assist the patient and to help them live comfortably for the remaining time of their life. The following are a few examples on how to maintain the patient's dignity. When speaking directly to the patient, you introduce yourself when you meet the patient and you never speak about the patient in third person if they are present in the room. To speak respectfully to and about the patient, you speak in terms that the patient can understand and do not patronize them at the same time. Patience and empathy must be practiced. Do not make jokes about the patient, and answer the patient honestly in order to build a sense of trust. When grooming a patient, ask how they would like their hair fixed. Explain what are you doing before you do it, especially if you're going to touch the patient. A way to ensure a patient's dignity is to protect their physical privacy. For example, when bathing the patient, keep the patient covered and only expose the areas that you are going to wash, or when changing the patient, close the door. Keeping the patient's physical appearance in order is a way to help maintain their dignity. Brush their hair, help them change, cut their nails if needed. In doing so, you can help the patient maintain their pride in their appearance. Lastly, is to create a respectful atmosphere. This means, in the patient's last hours, you are to help them to live as comfortably as possible. Play soft music for them. Help them meet any of their religious needs, and continue to speak to the patient even if they are no longer responsive, since hearing is one of the last senses to go. In the end, treat the patient with the care and respect that you would want to receive. Thank you for watching my video, and I hope you have a nice day.